is Whittle, and I am here in my hotel room discussing the procedures that I've had with my operation with IndiCure. I am from Australia, and it's a very long way to India. It's a long journey, but I think anybody contemplating making that journey will really benefit by having this operation. I suffered pain and disability, not being able to walk properly for probably 6 years, and I was a very long time on a waiting list in Australia to have this operation done. So I decided, as I wasn't getting any younger, I had to have something done. So I decided to go on the internet, where I just discovered IndiCure, an Indian company who catered for overseas visitors to come to India and have the operation. And as I delved into the information, I found the big benefit of coming to India was the operation cost $5,000 US, which was a very, very big difference from the $28,000 that it would have cost me to have had it done in Australia. But of course, you had to add on different things. You had to have airfares and hotels and all the auxiliary expenses that you have. But anyway, having never been to India before, and the journey was very, very long. It took me about 23 hours by the time I arrived in India, and I was met at the airport by a gentleman who took me straight to the hospital. That was on the Saturday, and I received a doctor there who gave me all the information that I needed. Then he said, you now have to meet the surgeon, Dr. Hitashi Kada. Hitashi, I've forgotten his second name, but I met him, and he came and explained the situation to me. And he said, we'll let you stay here for 2 days, the Saturday and Sunday, and I will operate on your knee on Monday morning. So in the meantime, we did all the preliminaries. He did the x-rays and all the other considerate things that you had to have done, pathology tests and heart rates and blood tests, urine tests. You went through the whole procedure, which was very thorough, and which I was quite impressed with. So we had all that done. Then I was moved down into a ward where I stayed for the 2 days until the Monday morning. And on the Monday morning, I was wheeled into the operating theatre, where I didn't have a general anaesthetic. I had a spinal anaesthetic, which numbs you from the waist down. Now, that didn't worry me one little bit, because I didn't feel any pain. But the amusing part, if you can say it was amusing, was that you lay there and you heard the hammering and the banging and the drilling, what was going on in your knee, which is actually a story that you can recount to your friends when you go home, which will probably amuse them quite a bit. So anyway, that's a story to tell for people when I go home. Anyway, I was moved back into the ward, and I think the general anaesthetic numbed my lower body, because I did have trouble urinating for a couple of days. So that eventually resolved itself, and so I started back to normal. Then I was laying in the ward every day, every morning, and the nursing staff were very good, very, very, very good, and very courteous and kind, and did all they could to help you. And you weren't in any pain as such, because I believe that when they operate, I think they inject an anaesthetic probably in your knee that numbs any kind of pain that you have, so you won't be in any pain. And when that starts to wear off, and they will give you these tablets that if you feel something coming on, then you take a tablet. You don't wait till you're in acute pain, then start taking the tablet. You take the tablet if you feel that there's a little bit of discomfort coming on, and that is the way to do it. But you're going to be in discomfort for a little while. You're going to have a physiotherapist come in your room and will give you the procedures that you have to do yourself after she leaves. And I was there for 4 days, 5 days, and she came in every day. And I did the exercises, and I walked up and down the corridor with a cane, which I was quite surprised to do actually. And on the day that I left, actually I don't know if they gave me one capsule too much, because I thought I was completely cured, because I was really, really good. But you are going to be in a little bit, you're not going to be in acute pain, but you're going to be in a little bit of discomfort, but you have to put up with that. And you have to get used to walking around with the cane, and slowly. You can't rush. You have to walk slowly and gently with the cane. And in the hotel, you will probably find that, well, I actually lost my appetite. I must be honest here. The food, I wouldn't say was a la carte. It was mostly rice and chicken, and it was spicy, and it didn't agree with my tummy, so I probably didn't eat very well at all. But then again, I didn't have an appetite, so it didn't really worry me. But anyway, I've overcome that now, and I'm in the hotel now, and it's a very nice hotel, very comfortable, and they're treating me very well. And every morning I get up and have a sponge bath, because you're not allowed to get the wound wet, because of any infections. If you get a wound wet and you get wet, you can get infections, which could cause problems. So what you have to do is you have to undress yourself, and you have to sponge bath yourself in front of a basin every day, which is kind of awkward, but you get used to it, and you get used to anything after a while. So anyway, I'm here now, and I have to spend a few more days here, and I'll return back to Australia on Sunday, and I'll be glad to see all my friends. And my son is meeting me at the airport and picking me up and staying with me for a few days. But the overall experience wasn't easy, but I think the benefits will far outweigh any other concerns that you have, because if you want to get better, you have to do something about it. So get off your backside, contact IndiCure. You'll find them very helpful, and I'm sure you will be very pleased with what happens.
So would you recommend your friends and family, IndiCure, to your friends and family?
Yes, put it this way, it would be so very much easier to have it done in your own country if you could have it done in your own country. But if you can't, you have to put up with a few inconveniences, and you have to bite the bullet, so to speak, and you have to do something about it. Otherwise, you stay hobbling around like I did, not being able to walk. So what are you going to do? Are you going to do something about it? Or are you going to sit on your bum and say, I'm not going to do it? So go and get it done.